From sunny Southern California, we bring you Meet Bridget, a podcast for building confident communication and female badassery. We spotlight women who have bridged the gaps in their lives by building strong relationships and speaking their teenage dreams into reality.
Bring it on, baby!
Fasten your seatbelt.
Welcome back to Meet Bridget, a show that sheds light on the often untold teenage and young adult stories of successful women from all types of backgrounds and in all sorts of careers. This show is an extension of our confidence coaching service for women. We've grown, we've adapted over the years, and we're just so excited to say that we're in our 5th season of doing this. For those of you who don't know me, I'm Keshiia Rosenberg, and I co-host this show alongside my best friend and Meet Bridget founder, Asha Gabriel. So again, we're in the business of sharing unique perspectives and the myriad of different journeys that each of our successful female guests has taken, how they've grown through and in spite of and because of life experiences. I am very, very excited, if you can't tell by how big I'm smiling, to welcome somebody who is very, very special to me. Her name is Dr. Hengameh Monsef. Hengameh Monsef, or Hengy, as I affectionately call her and so many other people affectionately call her, came to the United States in 1991 to pursue her dream of becoming a doctor. She earned her degree from Western University of Health Sciences and completed her residency at Huntington Memorial Hospital in Pasadena. From there, she joined the hospitalist group, caring for patients in the community while leading efforts to improve care through evidence-based medicine. She went on to become a core teaching faculty member for the internal medicine residency program, mentoring the next generation of physicians while also serving as an associate clinical professor at USC's Keck School of Medicine. Today, she continues to lead quality and safety initiatives at Huntington, shaping protocols and the best practices that impact patient care every day. She also is one of the doctors, one of the partners at our practice, Ascending Medicine. Beyond all of the titles, Dr. Monsef is one of the most compassionate, caring, thoughtful people I know. Someone who truly sees her patients as a whole person. She honors their stories, their cultures, their lived experiences in every interaction. She is also incredibly humble. And she would not describe herself as this, but I can. She is an incredible, beyond smart, super sniper level, precise physician. And her ability to blend clinical experience with the empathy that she has really earned her the trust of patients from all walks of life, including leaders, creatives, and some of the most accomplished individuals in the world. And they turn to her for not only her medical expertise, but her discretion, her wisdom, and her care. I feel so lucky to know you personally, Hengy. And I'm very excited to share your wisdom and perspective with our listeners today. So welcome to our show.
Thank you for this wonderful introduction. I don't think I can say anything to top that. So maybe we can just end the show and just make me look so good.
You do.
You made me better than I am, but thank you. Thank you for this great introduction. I'm honored that you even asked me to be on the show. You know, I'm not a great speaker.
You don't give yourself enough credit. You don't give yourself enough credit.
Well, it's as you mentioned, English is my second language. So no matter what's in my brain and what works, it's harder to express what you want to say when the language is not your primary language.
Yeah, that's definitely, there's a lot of truth in that. I know we've talked about this before. My mom, having immigrated to the United States, she writes a lot now. She's a screenwriter and does a lot of things, and it takes so much. I don't think anyone realizes or appreciates how difficult it is to start a career or have a conversation or be articulate in a language that's not your native tongue. So, but you should definitely give yourself credit because you are actually very articulate and very descriptive and detail oriented. And I think our listeners are going to find out. So some of our longtime listeners might remember me talking in previous episodes about my day-to-day working in healthcare. I talk about how I work in the concierge area of medicine, and how, we cater to patients that are, I say would fall in the ultra high net worth individuals and family bracket, but there are a lot of different steps to get there. I would love for you to talk a little bit about your day-to-day practicing medicine in this specific little niche that we are in.
I'd be happy to. It's, people looking from outside, it might sound very lucrative that you're taking care of ultra net worth, people that are quite affluent and successful, and they think that we make a lot of money and life is easy and so forth. What they don't realize is being available 24/7, it's quite a challenge, especially if you have a family, if you, and sorry for the bings.
That's okay. That's the real
that you hear. This is the reality of, actually, I got paged by a nurse, and right before this, we were supposed to start a program earlier, and I wasn't able to because I had to answer 2 emergency calls on a Saturday. So it's being available, and not only available, you have to be on it 24/7, be able to deliver. And people that, let's say, very successful people that are also busy, right? They travel all the time. They don't have time to wait for something to happen. And like an average person calls a doctor, the doctor's office gives them an appointment in 2 weeks, 3 weeks, sometimes 3 months. These people, they're in a different country, they're in a different continent in a week, or even tomorrow, for example. So they expect certain things to be done that minute. We always try to do our best to provide that. It doesn't always happen. We do our best, but then it creates a lot of, I would say, anxiety of delivering a right care. Because with that sense of, I want this and I want this done now, sometimes you can get wrapped into, well, I need to do what that person wants. But then you forget that your medicine is not something that it's on paper. It's just the reality of patients. Every patient's different. Sometimes I'm not even next to the person. I have to diagnose the person based on what they tell me, and be able to realize, is this an emergency? Is this something I can wait till Monday? Does it have to be taken care of within minutes or seconds? Do they have to call 911, or can I manage it over the phone? So those decisions come with experience. It comes with a lot of caring. You have to care. It doesn't work. It might work financially for some time, but if you are not caring, thorough, detail-oriented, and not determined, then something is going to give at some point. And we can make mistakes.
Yeah, it's definitely challenging. I think for listeners who think about concierge medicine, I think right away they might jump to what you see in the media. Like, I think like Nip Tuck, or there was that show about the doctor in the Hamptons who just did house calls. And especially in Los Angeles, there's this it's sort of a wide net, and it's the Wild West. Concierge could mean anything. It just means that you're paying out of pocket. I think one of the really interesting things that you've been able to accomplish, as you mentioned, and that we do as a practice, is we do a very high level version of that, where you're taking care of one person very holistically. You're managing their healthcare 365. So all of their appointments, all of their management, coordination, everything, and trying to optimize them so that they live the longest but healthiest version of their lives. And sometimes, like you said, that comes with figuring out, not even sometimes, I think the reason that you're very successful in this is you are able to look at patients. you learn everything you can about them, and it all goes into, like you said, what is best for you. So there's like a version of, population-based medicine, which most people are used to, where you go in the hospital and they say, you're a 35-year-old woman, so this is like the bracket you should fit into, but you actually get to look at the person and
so
do everything.
the concierge medicine is, I think, depends on what person wants. Going back to approaching a patient as a holistic way, autonomy of patient is very important. It's quite important, right? So some patients, we always advocate to provide, as you mentioned, holistic care, top to bottom, and not just do Western medicine that most people are used to apply what other modalities are that we can add to their care to provide them I want to call it medicine, but a way of treating them that considers their psychological aspect, physical aspects, and other modalities like Eastern medicine, if that's what they are open, acupuncture, or using other modalities so we don't rely on medications all the time, and coordinating those appointments when they're busy, and being there for them when they really need us, which it can be challenging.
Yeah, I know you have quite a few that actually think you're their best. I mean, you are kind of their best friend. They call you every day. And
don't advertise that.
We love them. We love them. One of the things that I think is really, really incredible is we live in this time where, obviously social media, TikTok, Instagram, people are consuming all of their information from their cell phones now. It's not like, 15, 20 years ago, you turn on the TV, you're watching the news every day. Most people I know will scroll through their phone and learn a lot through Facebook or whatever. And I think we are living and working in a time in healthcare when a lot of people really love wellness. They love the idea of wellness. They love the peptides. They love the IVs, but they don't trust like the science or the medicine because everyone's
and
very
vaccinations
anti-establishment right now. I think so. One of the things that I like is that we get to do a little bit of everything, like you said. It involves a lot of teaching. And so it's really incredible that, especially in this time, so many people still turn to you and have so much trust in you and your decision-making skills and collaboration and everything. One of the things that we've encountered as well is, especially with prospective patients, is some patients will ask, well, what is the difference between a DO and an MD? I would love for you to explain a little bit more about Doctor of Osteopathy and what that route looks like and how it differs from traditional, what people see as the traditional resident, fellow, all of that.
Of course. So, Doctor of Osteopathy, it originally started as physicians that used their hands and used anatomy, neuroanatomy to diagnose patients and manipulate them in ways that you allow your body start healing you. So that's the main point of an osteopathy. In the past, they had a different license, and then in 1960s, it was realized that there are doctors that have extra knowledge of anatomy, neuroanatomy, manipulations, and they look at patients as a whole rather than you come to me with a complaint of cough. Here, I'll give you a cough medicine. And the way we are trained is when a patient walks in, you look at them, you observe them, just even walking, your posture, how you keep your spine, how you move your hips, or if there is any discrepancies. I mean, it starts that. So basically, diagnosis starts the second you meet the person or you talk to the person, and then you, aside from talking and get a history, you really use your hands and techniques that you learn at school in order to figure out, all right, is this cough only a virus or bacteria, or could something else contribute to that? Mm-hmm. And that contribution would be if you hold your spine, for example, in a certain way, you're not taking deep breath. And by not taking deep breath, not only physically it affects the capacity of your lungs, you don't realize that you're not using the parasympathetic and sympathetic system that now everyone is aware of. They have their aura ring and they check their heart rate variabilities. And that's a new thing that everyone is following, right? So we've learned that at school, that it's a balance between sympathetic, parasympathetic, and how to use certain manipulations to improve your body. So we learn to, for example, touch the chest, ask them to take a deep breath, hold it, keep it for a certain amount of time, release it. And that stimulates your neurosystem and pulmonary or lung system to work with the medications that you might require. So we never say, no, you don't need medicines. However, we say use your healing process from your own body to help get better. That's the gist of what osteopathic doctors do. We do learn manipulations of lymph nodes. So we learn that it's not just muscles or nerves or your organs, that in the traditional medical school, they teach us like how lymphatic drainage helps improve health. After you get a cold, after people have surgeries. About 10 years ago, it was looked upon as, oh, these are all voodoo and it doesn't work. As you've noticed, the more studies that are done and the more people realize that they can use these techniques, the more Instagram accounts are popping up with, go to myofascial release, do this, so thankfully we are able to use those techniques without being looked down. We are not crazy doctors anymore.
Yeah, it's kind of a double-edged sword because on the one hand, we have people who are very anti, medications, vaccines, everything. But I think it like you said, it's very, very cool that on the other hand, there is a little bit of a shift back to an openness to look at different ways to heal. And it's an interesting time in medicine for sure.
Yeah. So yes. And the problem with that has been, in my experience, is when you have people that lose trust with the traditional medicine, and instead of staying in center, you get them, I'm not going to vaccinate. I'm not going to do any medications. We have cancer patients that refuse chemotherapy, even when there was vital to them. So you go all the way to one end versus the other end that you come in, I only give you medicines and I don't consider anything else. So I think the importance of, when we are flooded with information and Instagram, Facebook, and any other news, we have all different news agencies that are popping up, but they're giving health information. In order to do research and reach out to the doctor and make sure you're getting information, because I've seen in that process that people are getting hurt by doing too much of one thing.
Yep. It's all about balance at the end of the day. I want to bring our listeners back. I feel like I'm going to learn a lot more about you as well, but there are parts of you that are, we talk about your day-to-day, what a DO is. There's a lot of you in that is so unique and is like your secret sauce, right? Like, you're so detail oriented. Even when you are talking about your training, I think that there are probably a lot of things maybe that developed over time or maybe are just intrinsic to you even. So I'd love to talk a little bit about your beginnings, your childhood and teen years. You immigrated to the United States from Iran in order to complete your medical training. Did you always know you wanted to be a doctor? What was it like? Like, tell me about young Hengi.
Are you sure you want to know?
Yes,
It's
I
not
want to know
fun.
everything.
It's not fun.
And where the cheekiness comes from and mischievousness.
I don't know where that cheekiness or mischievousness comes from. Maybe it comes from pain, and that might be something that helped me heal because I've had such a rough childhood, or maybe I didn't even have a childhood. When I grew up and then in these times, with war between Israel and Iran, there's a lot of awareness. So Islamic Revolution happened, and so the kingdom of Pahlavis were basically destroyed. And I remember one of early memories of I was quite young, and we would come and we would see guns in the streets right in front of my house, or we would walk home and there were bullets in my dad's bed because they were shoot in the sky to celebrate or protest. And one landed in my dad's bed, where if he wasn't in his bed, he would have been probably dead. I am a Jewish Persian, and unfortunately, there were discriminations against Jews. We were minority in the country, and I say that with a lot of respect to my Muslim friends, my best friends from childhood, that I'm still friends with. So this is not something that I say that it's universal. But as a minority, in the beginning of revolution, when the students were protesting against Shah of Iran, I think one day, two of them were hiding. They went apparently in our building and hid on the roof, and we didn't even know. The military came after them and arrested them. Automatically, we were branded as we ratted them out, and we are the Jews that ratted them out. And the next thing I know, there were gallons of kerosene around our house, and bricks. They were breaking our windows and glasses with bricks, and they were ready to burn us alive in our home. And next thing I remember, my dad passed me along to another neighbor who was Muslim, and to save us and until military came and rescued us. So childhood was pretty rough, and I was called a bad Jew on the third grade, right in front of a whole class. And I turned around and I had no idea what could happen to me. And I said, "Well, what do you think? Do you like me to call you a bad Muslim?" I never did. With that, we remained at Iran because my dad, who studied actually in the United States, engineering, civil engineering, he had, they needed him for big projects to make roads and so forth. He was quite successful. And so we remained in Iran, where most Jews left. And I said that with some hesitations because, it's scary to say these things in a platform that it can reach the regime. And, I probably this is the first time that I've said it in some public platform. Things went on, and the regime they have certain rules and regulations, and they would come out in the summertime and they would arrest women because their hair was showing or they showed this much of a neck. And that I was one of the group. They pulled the car over, grabbed us from inside the car, and with my friend and my friend's mom. And there we go in a bus. They didn't tell us where we go. My parents didn't know where they were.
That's terrifying.
Yeah. So, and I was about to get 75 lashes. The only way I was able to get out was because my dad knew someone, a wonderful man, that was able to get me out. He put some money down, and I had to sign that if I were to get arrested one more time, I would be hung. So those are my, they're not all my memories. I had great friends. I went to school, but there were a lot of restrictions, and they would come into our classes, close the door, say hands on the table, remove your veils, and they would check our nails, check our eyebrows to make sure that you're not plucking your eyebrows.
Oh
They
my gosh.
check your hair doesn't have color, or
Yeah.
you don't have nail polish, or they would look into our backpacks to see if we carry things that we're not supposed to carry, or books that we're not supposed to have. So was a lot of restriction. I went in an all-girls school, which had benefits and probably, not so bad, it wasn't so good. With that, and then on top of that, we had 10 years of war with Iraq, with bombing every night. Like we had, every night we knew it was random. You didn't know if you're going to stay alive or not that night or the day after. So school was quite hard. People are quite smart. I mean, the things that I studied at all the way to high school, when I went to college here, most of it I knew already. And you have to work really hard to be able to be successful at the school. I think that background makes you different. Your brain, I was ready to die at age 12, where most people don't even know what that means. Ready to die, or so it was I want to call it a dark time, because we didn't quite have a playful childhood that everybody else have here. But it makes you appreciate what you have. And
Absolutely.
yeah. And then we had to go to Austria through an immigration organization to help Jews. I stayed there for a few months. And the funny part was, in Iran, we are taught 3 languages. Farsi is the first primary language, then Arabic is the secondary language, and then you get a choice between French and English. So by the time you get to the 3rd language, you're really not proficient. I got my first job when I was 19 or 20 as an English teacher.
Did you choose to be a teacher, or they assigned it to you?
No. So what happened was, in this organization, there were Jews that were migrating to different countries. It would be Italy, US, and wherever that was that they were able to escape to. The English teacher got sick. and these poor people reached out to me and say, "Do you want to teach them?" And I go, "Oh my God, I can't teach them." So I knew some grammar. I was able to speak some, but it was horrible accent. And I go, "Okay." So I got to teach the first class that they mostly were in their 60s, 70s, all the way to 80s. And I earned my first money, and I probably that was one of the highlights of my career, because I for the first time in my life, I was walking in Austria, and I saw a Swarovski store, and I was just fascinated with the bling, and it was just beautiful. So I spent every dime I had on Swarovski crystals and a watch.
I love that story. I love that. It's very harrowing to hear what you had to go through as a child and a young teen. You are still so close and loving with your family, and you are so family oriented now. And I think, a lot of your empathy clearly and your strength comes from, like you said, these times of immense hardship. Do you remember, how in your family unit during all of this, what were some of the ways that you guys were able to preserve hope or to have fun in those difficult moments? Or, were you able to ever laugh with one another?
Of course we did. We lost everything through migration, so it was quite hard. However, in my family unit, the way my parents brought us up, I never thought of money, which was not quite good because I didn't understand the value of it. So for me, losing things was tough. But having such a tough upbringing, I didn't know any other way aside from doing my best to survive. And we all did it. My dad worked very hard. My mom rose the family. She didn't work, but it was all about love. It was all about, my parents did everything for us to succeed. And we found moments to hug and kiss and argue, and like any normal family.
Yeah.
I think a lot of the stress was internal. We weren't so aware of psychology and self-care and all those things. It was mainly hard work. Don't worry about it. It will pass, and love each other. And, not only the family was together, my dad had to stay behind a couple of years. So it was only my mom and my brother. But my uncle would fly in from Germany to help. And then when we came to US, most of my family members left Iran in 1978, 1979. By the time I got there, here, my aunt and my cousins were quite helpful. And I was happy just to be here. I was happy to be alive and to be able to go to school where I was denied entering in college because they have this group of people that they come and analyze your family and your behavior and so forth, and they can change your life and say, no, she's not allowed to go to college. So for me, it was all about hope. It was all about, hey, I'm here, I do what I need to do, and nothing else matters. So I think that as you mentioned, the hope of opportunity, it overcomes everything else.
Did you know when you moved? I know you completed your medical education here. Did you always know that you wanted to go into medicine and be a doctor?
I didn't, not always. I didn't think of it as being a doctor. I was very curious. People would think I'm crazy, but when I was a kid in Iran, the chickens that you buy in the store don't come cleaned. They only pluck the feathers and they say, here, you prepare the rest. So it comes with intestines, heart.
Like a whole chicken?
Whole
like with
chicken.
The head, everything?
No, head is gone. Head
I
is
guess,
dead.
I guess you have to kill it. So. Oh my God.
Yes, the head's gone, but the internal organs are in. I don't think any other kid was interested. Like, I would sit and I would use a knife, open the heart from center, open it in layers, and the stomach of the animal or the chicken, or if they had beef, they would get the organs. So I used to.
Your mom wasn't worried you were a sociopath?
But no,
No,
she was happy. You know what?
Yeah.
Because she'd say, "Here, this is it. Why don't you
You
just
do
clean
it."
it?" I did the work for her. She didn't even think of. No, I don't think my mom even knew the
Yeah, I'm just
It
totally
was just like, oh, she's a curious child. Now I'm
Yes.
thinking back, and I go, "Am I?" And I go, "No, I care
Yeah.
too much. I'm not."
No,
But yes,
no.
I was very curious. And some of my friends made fun of me. Right before the test, they would say, "Okay, so you've read your biology book probably 3 times by now," and I would say, "No, I'm halfway through." And the reason was I read it because I wanted to understand and digest every single word in that book. And I didn't always get 100% because I made mistakes, and I wasn't probably good at test taking or whatever, or maybe I'm not smart enough. But I definitely wanted to learn. I still do. Like, that's something that I still read, and I am interested in learning new things, which gets me going, because it's tough to be a doctor. Let me tell you, it's tough to be a doctor and a mom and have a family and be good at it.
I think that your good is not even a fair word to describe you. I think it's too low of an assignment. I know you hate compliments, and I can see, where all of that toughness comes from, because like you said, a lot of it was born out of necessity and survival mode. There's so much vibrance that you bring with you now. I mean, I can't even imagine seeing you without some kind of color in your hair, like the reds and the purples, and you're always bright. Maybe not as bright as your husband Mehran, but
Hopefully not.
But I can really, like, when you paint the picture of being in a classroom and them coming in and making sure that you don't even have color in your hair now, is that part of the reason you think you're just so expressive with your personality now?
Maybe. I don't know. Any crowd I go to Keshiia, I'm the only one generally with the red streaks. So, and most of them are Persian. So I've been told that I'm not a typical Persian. I'm not, because I was raised the first 20 years of my life in Iran. There's a set of values that is different. So I consider myself Persian American because I'm so grateful to this opportunity and this land that's giving me this opportunity to my family, to my kids. But I think it's a mixture of maybe the resilience and curiosity, and I'm okay to change. I'm not stuck in old traditions. I think one thing that I think I challenge traditions. I'm Jewish, but I remember in the 2nd grade, I mixed beef and, don't tell my Jewish friends, I mixed beef and dairy together, and then I was ridiculed. Like, why you're doing this? Why are you not supposed to? And then I didn't know why I'm not supposed to. I knew the rules, but then I went home and asked my mom, I want beef and dairy, patties mixed I want to eat it together every day. And I take it to school and I show that girl. Like, you can't tell me what to do. So, and I still challenge religion. I challenge even science. Doesn't matter what it is. One quality I have is I don't necessarily say yes to everything. And sometimes I'm wrong, and sometimes I'm proven wrong, and sometimes I can challenge people and, make them a little uncomfortable, like of their beliefs. And I think that's all okay. So I think one reason that I have that is I am able to some extent, I break those boundaries and traditions or what I've been told, and think myself of, I want to try red hair. Like, okay, so if it's not in style or this, I'm going to do it. And I did, and I liked it. So now it's stuck.
Yeah, because who cares? I think it's so much fun and so refreshing to have conversations with you, and I get the benefit of. I thought my son's gonna come upstairs.
Bring him. I love him.
Oh, he's a handful.
He's the cutest.
He's mischievous. This is actually the perfect example. You are. You're always willing, like you said, to go against the grain. You like to challenge.
Come on, Jude.
He's okay. You love to challenge the norm because you can. And I think that's really cool. And I think as a doctor, it really serves you well because you're able to not necessarily look at somebody and say, oh, this is like the traditional diagnosis I would give you or a usual physician would give you. And you never just stop there. You always use that curiosity and that love of learning to dig in really, really deeply. And in that way, it's so fun because you're kind of like Dr. House. Like you're willing, especially to challenge other specialists if you feel like there's more to explore. And our patients, any patient you treat, I think really is so lucky to be able to have you as their advocate and as their physician.
Yeah, thank you. It's fun to do that. I managed to be Dr. House for many years. I taught residents and residency, and I was known to be a tough doctor, to be a tough teacher. I expected a lot from me. I expected a lot from my doctors, the doctor residents that were learning. And because that's a big responsibility. You can't just walk in and diagnose someone without considering other things. One time the program, I'm going to tell you this because it's funny. One time the program director, we had, of course, interviews and then reviews. And he said, you're like the broccoli. And I go, what? I said, the residents know that you're good for them, but they don't necessarily want it. It was actually quite a good analogy, just because it was a lot easier not to care, and it was a lot easier to come and let the residents do their work and not to challenge them to look a step further or ask them, so why do you think that is, or what you learn about this, and make them do extra work. So that's what he meant by broccoli.
Yeah,
it was a compliment to me. I took it as a compliment. Some people might not, but
I think it's a great compliment.
Don't be calling me broccoli starting Monday. I
love broccoli. It's one of my staple vegetables. Cruciferous vegetables are very good for you, for anyone listening.
That's right.
No, it's a fantastic compliment. And I also think it's very accurate because you are, even with our patients, like some people might think concierge, you just have to say yes to everything. And that's where you and Dr. Freeman really stop the buck and are very, very different from other physicians, and very unique and wonderful in that way, because you look at it not from what's easiest and what's going to be the
That's true.
simplest answer. You look at it from what answer is the safest, what has the most integrity, what is going to be good for you, not just make you happy.
And I think aside from that, I think my role is to give patients the right information or accumulate enough information for them to make the final decisions. And in the world of concierge medicine, the reason I bring that up is, I have a patient that is in Dubai hacking, tries new things, and I learn with him. I learn with other ones that do these things. So that makes me research, and then my responsibility is to research, give them the information, and there's been many occasions that they went against my advice, and it's okay. I hope they don't harm themselves in that decision making. I will not be part of that wrong, or in my opinion, wrong decision making, but I give them information. And, it's been occasions that they went against the recommendation. They didn't benefit, and they actually came back and said, you know what, I should have listened, or yes, the information you provided was correct, because now I'm dealing with XYZ consequences. So autonomy of the patient is important too. It's not all about the doctor. It's as to where we meet each other in the middle.
Yeah, absolutely. I think it's really a conversation, a constant conversation and constant education. If you're doing it the amazing way that you do it.
You complimented me again.
I know, I can't help it, but it's true. And I think, I am somebody that I started my career as a nurse in critical care and ER, and I have so much love and respect for that space in medicine, because you're there right at the second that the emergency is happening. So it was hard for me to leave that space. And I think in building my career beyond that, what has been very, very important to me, especially working in a private area, the private area of healthcare, is that I'm practicing and that I'm working with individuals who hold themselves to the highest level of integrity, and that it means a lot to me. And I know it means a lot to the patients, and it certainly affects their outcomes to do things the right way with the right information, and to allow people to come to these decisions. Like, you're not forcing somebody to do something. So I have so much respect for you, and I admire you so much. And it's really so special to see and to hear, where all of these different parts of yourself have been formed along your journey. I mean, you are very tough, but I get to see the bright, brilliant part, the soft parts, everything. It's a whole range, and it all comes from, having to survive and be tenacious, and to, like you said,
well, it's an honor to work
freedom.
with you, Dr. Freeman. I mean, I think I would not be able to do it without people like you, who you don't credit yourself, and you are a mom. You are the best person, one of the best persons I've met in my life, and I've told you that. And it's true. It's you do have that totality of you're so well rounded. I think it's important to keep ourselves, if at all possible, well rounded, because not only I think it makes you it helps other people enjoy your companionship, and vice versa. And then you get to enjoy world better.
Yeah.
So I think I just hope to do better and be better every day. And you make me better.
Oh, I feel the same way, but this isn't about me. This is about you.
It's about Bridget.
It is. I'm so grateful for your time. I think it's a beautiful story of resilience and strength, and I'm just so grateful that we are going to be able to share this with our listeners.
Thank you for giving me this platform.
Absolutely. We usually close our episodes with one final question. It's a little bit more reflective. So we ask all our guests, what is one quality that you had as a child or a teenager that perhaps you didn't realize or appreciate, but you've carried it through your life and you appreciate it now?
Looking back, and I've thought about this even, it's interesting you ask. I was told that since childhood, I was told I was very quiet. Mm-hmm. I was quiet. We had hours of trips, and I would not say a word, or maybe very little. But my mind was working, and I was very observant. I think that's been something that has helped me be a bit more grounded and a little bit more thoughtful, because before and it's not always true, but I try, or without trying, I usually think, because I'm not used to talking a lot. So that probably the observation and analyzing things in my mind, it was something that was I was born with it. It became advantageous. And sometimes it isn't, because I'm outgoing, but I'm not out there. I'm not very, what's the word? Extrovert. Mm-hmm. I tend to be an introvert. So it's advantageous in in many aspects of my life. Sometimes it isn't. Sometimes, but probably that's a quality I would say that I kept saying. I hear it in my like, you're so quiet. You're so quiet.
I love it though. You read the room. You more than read the room. You analyze everything. I'm so grateful that I get to work with you and know you and love you and call you family and dearest friend.
Same, Keshiia.
So thank you so much for your time. For anyone interested in learning more about Dr. Monsef, you can check us out or check her out on our practice website, ascendingmedicine.com. And you can learn more. Thank you so much.
Thank you for the interview, and I'll see you on Monday.
See you Monday.
Enjoy your weekend, Keshiia. Thank you. Bye-bye.
And that's our show. If you liked what you heard today, please like, subscribe to, follow, and share Meet Bridget with your circle. The best way to help our work here is to rate and review our podcast. We're listening and constantly working to build something helpful for you. Catch you next time.
Bring it on!